Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome everybody again to another episode of our show. Today bringing you another really awesome guest involved in creating a better tomorrow for many people out there. Today we have the honor of being joined by Tiara Green, who is president of Accessia Health, which is a national nonprofit 501c3 patient assistance organization that helps support individuals living with rare or chronic health conditions and leads the organization through their strategic organizational growth, expanding the organization's programs and services to really meet the needs in terms of healthcare of underserved communities. Ms. Green has been with the organization for over a decade and has over 20 years of experience in the public health and nonprofit sectors. Throughout her tenure with the organization, she served in various capacities, including as Senior Vice President of Programs and Policy, leading strategic development and health equity initiatives and helping to streamline their various operational processes. Currently, she leads initiatives to refocus and strengthen the organization's impact model as well as disease funds and programs, ultimately looking to holistically address the unique needs of the various communities it serves. Ms. Green is also the co-founder of a really interesting organization called Liberated Arts Foundation, which is a nonprofit that uses art to give back to local communities. Ms. Green earned her undergraduate bachelor's from Virginia Commonwealth University with a focus on exercise science with a concentration in community health education. Went on to do her master's from Virginia Polytechnic with a focus on community health and health promotion. Has also been recently named as member of the Forbes Nonprofit Council. A lot of really interesting topics to get into today on the patient assistance program front. We're honored to have with us Tiara Green. Thank you so much for taking the time to come on the show.
Thank you so much for having me. I'm excited to be here.
I'm excited to have you because this is a set of topics that we don't normally get into. So I'm really looking forward to this conversation. And would love to start off as we typically do before we get into all that by handing you the mic just for a few minutes to talk a little bit more about yourself. If you could just take us a little bit more into your background, how you got interested in everything related to public health, to community service, and a little bit of what got you interested in this domain of chronic disease and supporting underserved communities. I think that'd be a great way to get things going.
Absolutely. Absolutely. We always have these ideas when we're younger of, I want to be, right, a lawyer or a doctor, whatever it may be when we're younger, but I always wanted to be a physician. And it started really young with the love for medicine and being able to care for individuals. So I initially wanted to be a physician, and then said, you know what, that takes too much schooling. I am going to do something that is similar in that it's community health and public health and ensuring that individuals understand their health care. So I started off at Hofstra University, honestly, in New York, and I transferred to Virginia. And Virginia Commonwealth University had their community health education program under exercise science. So while I'm learning about community health, I'm learning about other parts of the body and how exercise is important, and started my career with exercise is medicine, right? If trying to get physicians to prescribe exercise as a form of care in combating those chronic conditions and as a way of managing chronic conditions. And it kind of grew from there. I worked with state departments of health, managing programs for diabetes and heart disease. Sickle cell is where I spent most of my time. And it became my passion. It became my passion because I began to see how individuals with that condition were treated differently. And as a condition where they are mostly impacting African American communities, you could see the difference in care. And I'd visit hospitals and I'd see a 5-year-old who suffered from a stroke. And you'd hear these compelling stories from these families, and it made me want to do more. It made me want to figure out, how can I leave my mark in this world? How can I have a greater impact in helping people access care? So once I left the health department, I joined Accessia Health and loved that it closely aligned with my desires and my goals and my values to help people. So, needless to say, I've been here for over a decade and still love what we're doing and committed to the overall mission of Accessia Health and helping people with those rare and chronic conditions.
Excellent. Really excellent. Yeah, it's a very interesting situation we find ourselves in because, on one hand, here we are all in the United States. We have an extremely vibrant and let's say valuable pharmaceutical industry that creates, so much in terms of healthcare, but we can't overlook the fact that we have millions of Americans that just can't afford their medications, even in 2024. And it's interesting because I spent a few careers ago, time in the sort of the pharmacy benefit management industry, in the 1980s. And at the time, sort of, the generics business was sort of the patient assistance program at the time, that we were able to create these products that were 90% cheaper. And that was all great, but we're not in that era anymore either, right? I mean, we have very few generic companies anymore. We have branded generics. We have a lot of these really expensive biologic products that don't have generics and so forth. So obviously other approaches are needed. I was wondering if we could start up by sort of taking us through a little bit of the history as know it better than all of us about the patient assistance program system, let's say, in the United States, sort of when it first started, and what's been going on in general in terms of, the scale of it, how many companies are involved, and so forth. It'd be great to sort of get a little of that background as we get into exactly what Accessia does.
Absolutely. Uh, Accessia Health itself has been around since 1989. So we
Okay.
know that the charitable patient assistance industry has been around for 35 years. And we were
Right.
one of the first independent nonprofit patient assistance organizations around, really established to support those underserved communities with helping them afford their prescription co-payments.
Mhm.
We know that the cost of care in the United States is extremely high. And while we wish we didn't have to be around, we were developed so that we were the safety net for these individuals who absolutely could not afford their care. And has been an integral part of the healthcare system for decades.
Mhm.
If you think about the industry, I believe there are about 6 or 7 main independent charitable patient assistance organizations. And I say independent charitable patient assistance because they operate on their own without any input from, pharmaceutical
Mhm.
manufacturers or other in organizations input. But over these last several decades, these organizations have provided over billions of dollars in financial assistance to qualified individuals who would not be able to access their care otherwise. So we're talking about impacting hundreds of thousands of people over time receive the care that they need. But the healthcare landscape over time has changed too. If
Yeah.
you blink, healthcare changes. We know that it changes on a day-to-day basis. So it's become more challenging, and we have to keep up with those challenges to make sure that we continue to meet those needs as we did 35 years ago, as we did 20 years ago, or even 10 years ago. How can we continue to make sure that we are giving individuals what they need? And that has really kind of led the way and helped us shape where are we going? How do we continue to meet the needs, even as we think of Inflation Reduction Act, which in
Mhm.
2025 will put a little bit of a cap, and I say a little bit because it's $2,000, a cap on how much people are paying out of pocket for their medications through Part D.
Mhm.
So that
Mhm.
$2,000 um, would still mean that people need these patient assistance organizations. If you think about someone with a household income of $45,000 with the cost of rent, the cost of groceries. I don't know about you, but they are extremely high right now.
Mhm.
But being able to afford even $2,000 with a fixed income is
Right.
a challenge. So we continue to be there for those that need us, and we know um, that they're going to need us. So, we're
Mhm.
we're being innovative with how we continue to meet their needs, whether it's beyond their co-payments and we're paying for out-of-pocket costs to pay for seeing their physician, for lab testing or durable medical equipment. We want to make sure that we are there as we have been.
Mhm. And could you say a little bit more? Because you mentioned qualified, and then you introduced us, and
Hmm.
I'm kind of a novice when it comes to, Medigap and Part D and all that. But what does it mean in 2024 to be qualified versus, say, 10 years ago? Because obviously, the U.S. healthcare system is its own unique thing.
Hmm.
What exactly does it, and explain what that means in numbers, where qualification ends and sort of the disparities there alone. I'd love to just understand a little bit more about that, especially for everyone. Obviously, you have a global audience here, but for those that know a little bit about the U.S. market, talk what that means for us.
I'll break down qualified in several ways.
Please.
When you think of qualified, that means these individuals meet income guidelines, which I'll talk a little bit more about here shortly. Means that they have insurance, and whether it's Medicare, Medicaid, TRICARE, we put that in the sector of you have public insurance or federal insurance.
Okay.
And then we have a separate bucket where we think commercial insurance or private insurance. And those are the individuals who may have insurance through their employer, they may have insurance through a marketplace, or they've gone directly to an insurance company to purchase an insurance policy for them or their family. And then for eligibility, we're talking about just having a physician confirm that you have a diagnosis, right? The
Yeah.
programs that are set out or out there for individuals who need it are diagnosis specific. And many people ask the question, why? That is because we operate pursuant to an opinion from the Office of Inspector General
Mm.
that says that we would determine eligibility and we would have it based on conditions. So there may be a program for chronic myeloid leukemia. There
Right.
may be a program for something like a bleeding disorders, but every program has its own set of eligibility criteria. I
Excellent.
want to circle back to that income piece because you said talk numbers, right?
Yep. Yep.
When we talk about eligibility for income, most of the programs are set at a 400% federal poverty level or a 500% federal poverty level. So in 2024, let's say you're a family of four.
Mhm.
That means that your income for that family of four could be $156,000 per year. It's a
Okay.
pretty generous
Yep.
income allotment for a household, but we know that with the cost of inflation, things are generally more expensive anyway. So you need to have a greater scale.
Hmm. Hmm. Excellent. Okay, with that, let's let's get into Accessia a bit. And before we get into the different programs you have per the, educational resources, financial assistance, and so forth, take us a little into the history of the organization, because you mentioned obviously you were been around since the late 80s, so the organization, I guess, has seen something like six presidents, multiple congresses and various iterations of our healthcare system. Talk a little of the background, when it was first set up, who founded it, a little bit of the types of folks that you have working in terms of their backgrounds and specialties, and just a little bit about what your role is as president on a daily basis, the type of things that you're involved in per the organization. And then in a little bit, we'll get into the different programs.
Absolutely. We have been around, as I mentioned, about 35 years. And our mission, even 35 years ago, was to be that safety net for those individuals who needed it. And we started off in the hemophilia area.
Hmm.
That was the area that resonated with our founder. And that is how we began in this space. Now, thinking 35 years, we've grown to over 80 plus programs that are approved by our board, which means that we can potentially help people in over 80 disease states. And we offer comprehensive services. So we offer case management. We help people determine what insurance options are available to them. I don't know about you, but there it is a very confusing landscape with trying to navigate all of your health insurance options. And for many people, they don't necessarily understand the difference between out of pocket or, in network, out of network. So
Yep.
we offer those comprehensive services, but we've offered them maybe within the last 10 years. So as I mentioned, we're continuing to evolve over time. And then we provide those educational resources and we provide financial assistance to help pay for their health insurance premium and medical expenses. When we first started, it was copays and premiums. And now over time, we've added medical expenses, paying for durable medical equipment, and then adding education. And then we've also added attorneys who represent clients for free who are appealing Social Security disability decisions. So whether they're trying to get Social Security disability income or Social Security income, because they're a little different, our attorneys represent individuals with rare and chronic conditions,
Hmm.
and they go in front of a judge in a hearing and they tell them why this individual may be qualified for Social Security disability. So we've been here. We have no intentions of leaving unless our healthcare system changes. My role now as president is really to continue to lead these initiatives and refocus and strengthen our impact model. How can we continue to grow? Understanding we have some changes with the Inflation Reduction Act. Where do we see the individuals still needing our assistance? And are there additional conditions that we should be focused on over the next year, 2 years, 3 years, right? As these additional treatments become available, how can we continue to help those that are in need? And then how can we focus on health equity as well? Want to talk about that second part that you were asking, who's on the team? When we
Yep.
talk about those conditions and looking forward to say, these are the individuals who needs us. Jen Noonan is on our team and she is our clinical expert, but she does a phenomenal job with looking at the landscape and saying, hey, this is a condition where these individuals are suffering at a greater rate than some others. The treatments may be difficult to reach, meaning they may need travel assistance to get to their physician. Maybe it's a treatment facility maybe there's only 3 in the country. How can we play a part in their overall healthcare journey? And then she partners with advocacy organizations to better understand that condition as well. She has a wealth of knowledge, and I always tell people that we are um, grateful to have someone with that clinical expertise on our team because it means that we're thinking differently. It
Hmm.
doesn't mean that we are just going after things that we think make sense. We have some science behind it. So
Yep.
I'm very proud to have her on our team. And then we work with a very strong IT team that helps us to continue to improve our services that we offer from a technical standpoint, making the process easy to understand for those who may not necessarily have the patience to
Right.
look at the system and don't feel well. I don't want to interact with a difficult system, right?
Right.
How can the
Right.
system be easy to understand, but also compliant at the same time?
Yeah, that's key because even I'm not adept at it at all, and I always, my wife usually takes care of most of that. But it's, even for someone, I've been in the industry a long time, and I feel sometimes like I'm in kindergarten in looking at some of these materials. So I really appreciate that aspect of it as well, and how you're helping to support folks on that
Yes.
front, and that's awesome. Tara, you mentioned, we were talking about some of the conditions before, and and for we'll put the links obviously in the bio of the program, but one can go to the Accessia Health website and really take a look through a rather extensive list of the patient programs. You mentioned chronic myeloid leukemia before, and this list has everything from sort of major chronic diseases in it, like CML, like asthma, like pulmonary fibrosis, to a wide range of rare diseases from Pompe's to Fabry's. Talk a little bit about what happens at this portal. I can only go so far into it without logging in, but what goes on in that? And I noticed like things like say Fabry here is divided into privately insured and publicly
Yes.
insured. How does this all work in terms specifically of patient access into the system? And then we'll get to providers in a minute.
Absolutely. From a patient perspective, the portal allows them to apply for assistance. They simply choose, I have Medicare, I have Medicaid, I have a plan through my employer, whatever it may be, they choose their insurance. Once they select their insurance, it goes through, these are the programs that are available. What
Hmm.
is your diagnosis? They select their diagnosis and they can then select the program and enter their demographics. I love our portal, and we just revamped and we just released this new portal that is easy to understand because individuals can upload documents through our portal.
Hmm.
They can access educational resources through
Yep.
our portal, and they can see their payment history or even interact with our representatives by sending them a message. For our educational resources on that page, we have a partnership with a company called Burn Along.
Okay.
They can access Burn Along and see these videos on physical fitness for certain conditions. They can access videos on eating resources, how to check their blood pressure. It has a plethora of videos focused on healthcare and exercise and maintaining their overall well being.
Hmm.
They can also access links to get to our previous webinars. And we do have webinars available to those that we serve and even those that we do not serve as well.
And while we're at the portal, you mentioned obviously the difficulty in patients who are sick understanding the
Hmm.
dynamics here, but we also hear all of us have physicians that
Yes.
they just are overwhelmed nowadays too, and getting an approval for something, or
Hmm.
them to say, hey, yes, this patient needs X. Um, Difficult as well. Can you talk a little bit about sort of your interaction with the providers? Because I think that without that piece, which you clearly have here, it's a lot harder. So if you could say a few words about your interaction with the providers, and how the system helps from that angle as well.
Absolutely. And we make it really easy for providers. They do not have to have a login to get into upload documentation for a patient. They can simply add in the patient's name as well as their ID, and they can upload the medical care provider statement. And that is the document that I mentioned with eligibility, in that they have to, attest that I see this patient, this is my patient, this is the condition that they have,
Mm-hmm.
and they sign, provide their contact information, and allows them to upload in an easy manner. If there is a social worker within the provider's office, they can also work with the patient and submit an application if they have permission. So it's a very, I'm going to say maybe 5 to 10 minutes to complete an application, but they can walk that person through the process. You mentioned my wife handles all of that. For some people, it's, hey, they go to their doctor's office and say, I need help. And they're
Right.
working with the social worker and going through the process with them.
Right.
What I love about this too, in the provider aspect of them walking through this with their patients, is that they can also access these educational webinars to understand those that they serve a little bit better as well.
Mhm. Mhm. Tara, one theme that, we have touched on a little bit on the show has been the when it comes to underserved communities, the issue with many communities not being able to appropriately access clinical trials. And, when I was looking at your portal, it seems that, based on, the connections you have, it seems like that would sort of be a natural component of something else. I don't know, and if I'm touching on something that is confidential or you may be building, then we can go right by it. But anything happening on the Accessia Health front in terms of not just connecting the underserved communities with existing therapies, but therapies in development, because a lot of us obviously need the new stuff that's coming through the clinical trials, and there's always a disconnect there as well. Anything happening on that front, or is that just a separate industry by itself?
Well, I'll focus on part of that question. You talked about underserved communities
Yeah.
accessing medications that are already available,
Right.
right? And I think that since COVID, this has been more of a spotlight in many conversations, because we saw the impact that COVID had on those underserved communities.
Right.
So we are doing some work in underserved communities. We are a partner in one particular zip code in Louisville, Kentucky,
Okay.
working with the Coalition to Transform Advanced Care. And this is a different model. It's an
Hmm.
interesting model that we're working in, but excited because it offers us the opportunity to say, we are looking at the specific needs of this community
Right.
and how can we meet them where they are to make sure that they're getting access to screening and diagnostic services that are clinically recommended. If you look at the data out there, it'll tell you that only 8% of the US population actually receives those clinically recommended screenings at the specific, age that is recommended.
Mhm.
And we want to make a difference because we know that if they get in early, then there is a greater chance of survival and managing some of these chronic healthcare conditions. Think about the number of people who are now dying from colon cancer, and you see
Yeah.
this, it's more prevalent around underserved communities.
Yeah.
But if we are ensuring that people have access to colonoscopies earlier, we're
Right.
ensuring that people understand and we're providing some education and improving health literacy in that area, then we're able to make a greater impact. So that's where we're focusing from a underserved communities perspective. We want to look at certain areas to really hone in and partner with those community-based organizations on the ground to say, what can we do? How can we ensure that the work that we're doing is impactful and improving healthcare outcomes for those in that city, county, town, whatever it may be?
Awesome. So, there are clearly, when your organization was formed, the blockbuster drugs that existed then are much different. Well, the ones now are much different than then. That I call it look sort of little pills in bottles from our pharmacy, which were X, now have gotten extremely expensive in terms of the biologics and the immuno-oncology. And when we look at the stuff that's coming down the pipe, and some of this here, when we're talking about, $100,000 per month the price tags, or $5 million one and done gene therapies, That changes the equation a lot, and
Mhm.
obviously your responsibilities and challenges change as well. And I was wondering, if you could talk a little bit about some of these challenges facing the patient access program industry when you're getting, exorbitantly priced, uh, you know, blockbuster things to do great stuff. But come on, I mean, aside from a few billionaires, I mean, who can afford this
Who can
stuff?
afford
So
it?
yeah,
Who can afford it, right? The treatments are expensive, and we know that the access to these are going to be compounded by the rising cost of those
yeah,
daily living expenses that I mentioned earlier.
yeah,
Um, we're living in an era of inflation. It leaves room to widen that health equity gap.
yeah,
So while they offer hope for many people, they come at a high price tag, and we're still unsure of how the insurance companies are going to pay, and they may be reluctant to pay. And small businesses, depending on their insurance plan, may not be able to afford some of these newer complex therapies as well. So there's this shifting pressure on families on how do we continue to manage our care.
hmm
So
hmm
you mentioned going from tablets, these little bottles, but as more biologics are available rather than, these tablets and capsules that you pick up at the pharmacy, some individuals may now need to travel to a specialty clinic for an
Yep,
injection.
yep,
So the time that is required to get to that specialty clinic for the infusion, do I need to stay overnight? Do I need to pay for the gas? It becomes astronomical. So now I'm thinking about paying for that medicine and how am I getting there?
right.
And the two put together puts a significant strain on households. So we are trying to help as much as we can, and we do offer that travel assistance, and we'll help pay for the infusion costs and the medication as well. Um, but the percentage of people who have to choose between food and clothing or going into debt for paying for their healthcare expenses is high,
Yeah.
and they may choose to delay their care, which is going to lead to higher morbidity, higher mortality. Um, I ran across this statistic a few months ago that said Americans have about $220 billion in medical debt.
Mm,
Billion. That's a lot of money.
mm,
With about 3 million people owing more than $10,000 each just in medical debt. So those with rare and chronic conditions are likely to see an increase in debt over time as they attempt to afford these new treatments and even the existing treatments as well. And you're going
mm,
to see it higher when you think about the African American population because they're reporting 13% um, higher debt than the national average. So we have our work cut out for us.
yeah.
I mentioned earlier, we have this fixed income population, those Medicare recipients who may have an income of about $45,000 trying to afford those medical treatments and still live. But the reality is that some of them are making some very difficult choices that
Mm,
we shouldn't have to make.
I know.
That's unfortunately the truth.
Yeah. It's always a sobering
I know.
comment. I appreciate you bring that up. No, but no. Um, let's talk a little bit, if you would, Tiara, about some of these conferences that you have lined up in 2024. Because clearly, as you were mentioning, a major part of your organization's work is partnerships, collaborations, building these important networks. It seems that you're getting to quite a few, both of some of the major conferences in terms of World Orphan Drug to
Mhm.
ASCO to a lot of the specialty. You're going to the Alpha One National Conference, MBDF bleeding disorders. Talk about what's coming up, and a little bit of just you know what you experience as a patient assistant program leader thought
Mhm.
leader in this space as you get out there and, mix up, with the pharma companies and the healthcare organizations and everyone else that shows up at these, and any specific ones you want to highlight that are coming up for the second part of the year.
Yes, we will be at the ASCO conference. That's at the end of this week.
Oh,
So
okay.
coming up here shortly, and it focuses on oncology.
Right.
So our team will be present. Jen, who I mentioned, is our clinical expert, will be there. And what I love about these conferences is that we choose them um, based on not only how can we reach these patient advocacy organizations, but how can we learn, right?
Mhm.
How can we learn about those conditions that are going to impact our um, patient population the most? So that one is coming up. We have a booth at that conference. You mentioned Alpha One National Conference. That is in June, and we're excited to attend that. We have an Alpha One program. So it kind of aligns with what I was saying. Our
Mhm.
goal
Mhm.
is to make sure that we're learning about these conditions, and if there is more that we should be offering, it helps us to learn about the particular needs of that community. We also have the big one that's coming up. The is our healthcare advocate summit. Sorry,
Yep.
healthcare
Yep.
advocate summit in
Mhm.
September, and that's in Vegas. And that one has always had really good energy. It's a lot of patient advocacy organizations, but there's a lot of patient advocates, right? These are the people on the front line that are really working with individuals to understand their care and helping them navigate. So we learn a lot from those attendees on what are some hiccups that you are experiencing as you're trying to help these individuals navigate. And we learn and we take that and we try to make sure that we are doing our due diligence in assisting individuals.
Awesome. Really awesome. Um, so one other thing I wanted to just touch on while I have you, and I love, hearing about, the whole story of our guest, and I was
Hmm.
really intrigued by, in addition to everything you're doing, you also were the co-founder of this really cool organization called Liberated Arts Foundation. And we actually have talked a little bit about arts in different contexts of on our show, more from the perspective of the elderly, and we actually did an interesting episode on arts and rare diseases.
Oh,
Talk a little bit about, what's going on with the Liberated Arts Foundation, when you set it up, a little bit about the focus. And I know you have an exhibit coming up in Richmond, I think, next month.
yes.
So talk a little bit about what's going on there as well, if you would.
Um, Everyone else would think you're crazy, you're taking on another project, but it's a labor of love, right? I truly believe in giving back to the community. And this is a joint venture with my husband, who's an artist. So
Nice.
it's combining his love for art and my love for community and education and health. And we marry the two, right? We say, how can we utilize art and we as a way to give back to the community? So that's really what we're doing. We use art and we consider art as a catalyst for change. So we hold art events and we raise money based on the art that is sold in the events that we hold, and we donate to a nonprofit in the local Richmond area that is really making an impact in the minority communities or underserved populations in the area. So this started about 5 years ago. I was sitting on the sofa and I said, you know what? Poor husband, your wife has those like light bulb moments of, I've got an idea.
Oh, yeah.
I had an idea and I said, what if we hold an event, we raise funds, and we give it to a nonprofit that are doing great things in the area?
Yep.
We only took 1 year off, so we're back at it and we're celebrating year five. But we truly host events and art exhibits that shine a light on different areas of concern. So we've focused on literacy within Richmond City. We focused on food deserts in Richmond City. We've also focused on mental health And this year, we're focusing on homelessness in the area and hoping to give back to a nonprofit that is doing great things to really help the homeless population here in Richmond. So
Right.
it is my labor of love outside of Accessia Health in my hopes to continue to give back to the community.
No, no, it's awesome hearing about that, and yeah, it's a beautiful side story, let's say, but
Eh,
it's really not on the side. It marries everything up that you were mentioning just about your story, and I think it's wonderful. So I
Thank
appreciate you
you.
sharing that with us as well. Tiara, while I have you, any final messages for our audience? Anything that I missed that's coming up for Accessia for the second part of the year that we should know about, or anything else that you want to say while we have you today? Please take the floor.
Absolutely. First of all, thank you for this opportunity. It's always good to chat and talk about all of the great things that we're doing, but also to shine a light on where the healthcare industry is at this point and where it's going. We are excited to attend the upcoming conferences that I mentioned, and I can't forget the National Bleeding Disorders Foundation conference in
Yep.
Atlanta. We'll be there. We'll be speaking at as well. But also, we know that there are great things on the horizon. So, this is a little teaser to say stay tuned because we are always going to look at different ways to make a meaningful impact. And that's the key, meaningful. So, I'm excited about what's ahead, but I'm also excited about the work that we're doing right now to positively impact the patients that we serve.
Standing. Beautiful story. Really wish you and the team the best with it, Tiara, and I look forward to a follow-up maybe next year and
Yes.
do an update on everything that's happening. Again, for everybody that is going to be listening to this episode of our show across the various podcast networks or watching on our YouTube channel, again, you've been spending time with Tiara Green, president of Accessia Health, doing really amazing things to service this also important safety net for literally millions of Americans in need. Tiara, I want to thank you for taking the time out of the schedule to talk to us for a while, to educate us on everything going on there at Accessia. Obviously, thank you for what you do for millions of people out there. And as we like to say on our show, thanks for helping to create a better tomorrow for so many people. A really great story, and really wishing you and the organization the best.
Thank you so much. We appreciate you.